Hello, everybody. Thank you very much for the introduction, Ashley. I really appreciate it. As Ashley said, I'm the CFO, COO of 4P Foods. 4P was founded in 2014 with the goal of addressing the inequities in the existing food system and looking at that at issues on both sides of the supply line, starting at the farmer-grower level, providing them access to markets, including marginalized communities of farmers that have traditionally been ignored and underfunded by the traditional food system. And then on the other side of the pipeline, helping to provide food access to communities that would otherwise not have it, and trying to find a way to make those two goals work at either end of the pipeline and build a structure in between to connect one to the other. So for everybody who has been in the food system for the last pandemic years, it is obvious to us from before the pandemic that our food system wasn't working even before the pandemic. But during the pandemic, it became incredibly obvious that it's not working for anybody, that the system is fragile and that it broke. And during the pandemic, even people who had traditionally been well served by our food system found that they were not able to get the things that they wanted at the times that they wanted it, and they did not have access to food, perhaps for the first time in their lives. We believe that the systemic inequities that have traditionally existed are only going to get worse if we don't change how we're growing and distributing our food. Taking a kind of a big step back and looking at the industrial agricultural system as a whole, we saw that it was rigid and fragile and prone to point failures within the system caused by the pandemic. And of course, all of us are still struggling with the supply chains, even since things have started to move a little bit back toward a new normal. But we view this as a long-term issue for our food system. We really have to change where and how we are growing our food in the face of changing climate and the impacts climate is going to have on the production of particular produce and some of our other key items for the food system in areas that are very vulnerable from a climate standpoint. We really believe that we have to change where and how we're growing our food. We need to shorten the distance traveled between our food and its end users. We need to build new sources for products, and we need to increase access to food, both for the rural and even urban communities that have traditionally been marginalized. In short, our thesis is to pay farmers what they need to pay to survive, and then to provide access to food for those who don't have access to it right now, including communities that have traditionally been food insecure. That sounds great on a mission statement. It's a little more challenging on an income statement. And we have been working, 4P Foods has been working to find innovative ways to make that happen for the 8 years that it has been a business. But even now we are moving into a new level of being able to connect farmers and communities that need food with the recognition that our food system has to change, gaining much wider acknowledgement throughout the government and throughout individuals. We are trying to reimagine the industrial supply chain and build something different. This is our vision of trying to create a supply network that serves DC and Northern Virginia in particular, but eventually will serve a wider area. If we can increase the throughput of food by reducing the cost of moving food from local farmers to those in need of food locally, we can start to compete with the traditional supply chain and start to provide food that is nutritious and fresh and helps people to deal with the challenges of getting food in their own communities. So overall, what we're trying to do is build a replicable, regenerative, equitable food system that is based in a net negative carbon footprint, renewably powered. We want the entire cold chain to be powered by renewables, circular, where waste becomes compost, becomes soil, becomes produce for us back at the start. And we also want it to be equitable and humane, accessible to all, and humane treatment of all beings that are involved with this food system. And we're trying to build this in the Mid-Atlantic, pilot it, and prove that it can be expanded across our region. When we think about the impact that we want to have, the mission part of what we are trying to accomplish, we look at a number of different measures. One is just how many dollars are we putting into rural communities, providing to farmers who otherwise would not be able to invest in their own businesses. And that those numbers have been increasing steadily with a huge bump during the pandemic. But we also look at how many farmers we are serving, which has steadily been increasing. We're about 94 farmers now and looking to be about 115 by the end of this year. How many food hubs and co-ops are we working with, who then work with another large group of farmers? How many regional processors are we working with, many of whom are BIPOC, woman-owned businesses, small businesses that we are helping to build their businesses and transition from us to other distributors to distribute on a wider scale. And then we also look at how many bags and boxes of food we have been able to bring to communities in need. And that has scaled up significantly through the pandemic and continues to be a major part of what we do. And I will talk a little bit about some of the programs that bring that food to people in just a few minutes. So on the grower side, our producers earn 60 to 80 cents out of every dollar of our sales. Whereas in the industrial food system, when you see something in the grocery store, you're generally looking at 14 cents to 16 cents on the dollar that the growers actually earned. This means more money going into our rural communities. It means farmers who have traditionally been marginalized and not had access to capital are able to invest in their food, in land, in seed, and in growing additional food. We have a very specific focus on BIPOC farmers and have partnerships in place to help BIPOC farmers have access to capital and access to markets. We have commitments from institutional customers who specifically want to partner with BIPOC grower communities in order to provide them with capital and the commitments they need to be able to expand. Nadine from Taliwa Farms on the Eastern Shore is one of our growers who is meeting the demand for Afro-Caribbean specialty crops, which has been an interesting way to provide food appropriate, ethnically appropriate food to communities that we serve, both in food access communities, but also we found our retail customers are very interested in diversifying the food that they are receiving. We have a number of food access programs. I'm going to share two of them in particular that we work on. We have a partnership with the Children's National Flip RX program. This program is an ongoing study that is looking at the impact of providing fresh fruits and vegetables to food insecure families. It's funded by grant dollars. Families receive nutrition education and fresh produce delivered to their door biweekly for 12 months. The first paper has just been published on this study, and they have found the qualitative data is very encouraging. The quantitative data is not yet supporting fully what we believe it will show in the long run, but the qualitative data shows that there was a real reduction in food hardship and an increase in healthier eating, which has been documented across the group that we have been working with. This program will be ongoing this year, and there'll be additional papers published out of it. We are working toward programs that we believe will be able to provide access to people through food as medicine types of programs. And finally, the National Youth Baseball Academy Field of Greens program we've been working on for many years. This provides food to wards 7 and 8. So I will end by just saying that we are trying to create a food system that is equitable and that serves everybody, no matter their address or income, and also increases the ability of farmers to provide local food. Thank you very much.
First off, I want to say thank you for all your hard work, because it really means a lot to me. It means a lot to my team. And I think together, we in this room have an ability to literally make a change. And it just takes us as people, because we're all human. And we all can do something about it. And it's time. it's time. I think everyone in this room has a story. I'm not going to bore you with mine, but I think it's all touched everyone, and that's why we do what we do. So I think it's time to collect in here. So Tangelo is an all-in-one personalized food benefits platform. And it starts with 3 core things. Number 1 is about member insights. We have to meet people where they are. In order to do that, we have to understand where everyone is. So we really have to understand that data. Number 2, it's about nutrition interventions. Everyone is in a different situation, and we need to meet people again where they are. Some people have diabetes, some people have hypertension, some people are low income, some people have cancer. Everyone needs a different intervention. And the third is patient engagement. I think we've all seen how hard it is and how many people battle back and forth from behavioral to all different things. So we need to engage them correctly and really help them. So the question is have we actually deployed our platform? The question is yes. We've delivered 40 million meals in the last 18 months. We have 8 fulfillment centers across the United States. We have coverage across the entire United States. We work with hundreds and hundreds of small farmers. Most of our farmers are small to medium-sized BIPOC farmers. We also have 5 coming on 6 different meal kitchens across the United States. In terms of being audited and being checked out and how it all works is, yes, we have gone through the Boston Consulting Group as well as the USDA. We also are fully SNAP approved. That means in every single household in America, well, 49 states, we can have people with a SNAP EBT card loaded on our application and place an order and get that food delivered to their door. So there's no access issue anymore. We also have, in terms of WIC, we're working state by state with WIC. WIC is very unique. I mean, you're talking down to a brand. I mean, hello. So our platform also is in every state ready enabled. We just have to work with every single state to make that a reality. But from a technical standpoint and from a delivery standpoint, it's ready to go. What do we deliver? We deliver a couple things. Number 1, we have to meet people where they are. Produce shelf-stable meal kits. So some people like to cook. Some people have the ability to cook. The second is some people don't. So we need to have prepared and medically tailored meals. And someone like myself, I'm combo. I'm the person that's really busy. I love to throw something in the microwave, but at the same time, I like to cook. I want something easy, but I want to throw it in the microwave. So the key is making sure that everyone has access to whatever their needs are that are culturally relevant and that meet people, again, where they are. In terms of do people like it? The answer is yes. 99% quality rating across all of our meals. 4.8 stars out of 5. And we deliver proof of delivery in every single order. And 24/7 multilingual customer support, work across 25 different languages. This application is in Spanish and English from an application standpoint, but 25 languages from a content standpoint. What's very important too is we also understand that people don't have technology. So we actually give them a smartphone and internet access. We have our app preloaded on devices and ship them a device so they have access with internet and our app downloaded. In terms of some case studies, we have some here that there's different types of groups that we work across. So in terms of, for example, employer network, so New York Presbyterian, it's given to all their staff as well as in their community. DHS, we're providing medical nutrition therapy as well as meals and groceries, or the state itself, they're taking COVID dollars and actually deploying it across low-income areas, or counties or farm to families type programs, as well as SNAP programs. In terms of engagement and how we think of things, I'm fundamentally a believer in adherence. So yes, we do a lot of engagement because we need to understand where they are. We collect a lot of data and so on. But then it also comes down to the adherence of making sure that people actually follow through. And we all know how hard it is for people to follow through. So we use food to really incentivize people to follow through. One other piece, an example here is that we had 5,102 people take a health risk assessment in 7 days in a low-income area. We understand how hard it is to work in low-income populations. It's an example. This is something that we work really hard on. We've been talking a lot about incentives. Well, today, it's a reality. This is our tangible nutrition incentive. This is a safety net that is available for the entire United States that allows anyone to spend their own funds, and when they do so, they actually get a tangible nutrition incentive. So that means, for example, if you're a family of 4, you get $250 nutrition incentive. So when you spend $80 of your own funds or WIC funds or SNAP funds, you get an additional $24 in free healthy food delivered to your door. This is an actual product that is live. This product was created on the behalf of this, if everyone's done DARI research with Tufts and so on, well, they have this big study. It's all about 30% nutrition incentive. Well, that study is now a reality. We can actually deploy this across every county, state in America. Now, when it comes to, that's the baseline. That's what everyone gets. Now, the next step is again, we have to meet people where we are. So what we do is we work with payers, we work with counties, we work with states. And first step is we actually create personas. That's the first step. The second step is we start to look at the top. This is an example of a payer. I didn't want to say who it was. It's an example of a payer that had different top line and bottom line goals that they wanted to achieve. So we listed those across the top, and then we started to go through each one of the personas and then checked off, yes, they want needs to be addressed. No, they don't, or we don't know. So we first create these personas for each individual person, because then our technology, we literally configure so it's personalized down to the individual. So once we do the personas, the second step is what do? We turn on the different food benefits. So we turn on a heart disease food benefit, an LTS food benefit, a gestational diabetes benefit. We have hundreds of different food benefits, all modeled on different research. We turn these different food benefits on. The second step is we turn on different education and resources. These education resources are, again, based on lots of evidence, lots of research and so on, as well as different resources within the community. Sometimes it's not education that we need to connect them somewhere in that community. So we turn these on. The next thing we do is we turn on different incentives, because a lot of payers might not make money on food, but they'll make money on closing care gaps. So what we do is we turn on different incentives. Let's give free groceries for a health risk assessment. Let's give free groceries to set up mail order prescriptions. Let's book a primary care physician right through the application. Let's incentivize. We turn on these different incentives, and then we deploy an actual customized user experience for every single person. So once someone logs in the application, either from the clinical data or our data or one or the other, they then join that application and they have a unique benefit that is designed right for them, a full experience. Here's an example of a user journey of a AHA food benefit design. This is an example that we kind of created. So this is, hey, if I have someone that has heart disease, well then you're gonna have the benefit example, you're gonna have education every week that you're gonna go through, and then you're gonna have different food that is attached to that education that you're gonna click and order and deliver to your door. So every single person that goes through this experience will get a personalized user experience. And how do you manage all that data and all those people? We have a platform that you log into at a payer level, county level, government level, state level, that you can view every single person, all the different gaps, every single thing in one place. So you can manage the population at scale. But it all starts with the persona workshop. Because every single person is unique. And once you do this correctly, you can deploy it across the country. Because it needs to meet people where they are. And that's really it. Thank you.
Thank you, everybody, for having me. My name is Dan Wexler. I'm the CEO of Eat Well Meal Kits, where we believe wholesome food changes lives. Eat Well creates food as medicine meal kits that can be prescribed to high-risk patients to address nutrition insecurity, prevent diabetes, and advance health equity. Disclosure, as you all heard, Eat Well in 2020 received a grant from the Social Impact Fund of the American Heart Association. And for those of you who may remember, spring of 2020 was a pretty dynamic time. And that grant was really catalytic in enabling us to realistically completely pivot our business model and go on to be the organization that we are today. And the organization that we are today is a 5-person Boston-based startup that went on to serve 40,000 meals so far. And I'd like to tell you 3 stories in the next 8 minutes about our journey as our organization developed, as we refined or further understood and matured our definition of access, and what I really mean when I say that we believe wholesome food changes lives. So the first story is why nutrition security. Eat Well actually set out with a vision to prevent diabetes. There's 1.5 million new cases of diabetes every year that drives more than or almost $330 billion in healthcare spending annually. And of course, has about an 8.5-year reduction in life expectancy of patients who become diabetic. Fairly significant challenge, but with significant challenges come significant opportunities, and that's that 80% of diabetes cases can be prevented. The Mayo Clinic recommends lifestyle modification, adhering to a healthy diet, as the best way to prevent diabetes, and some research that folks here may be very well familiar with suggests that food can be 2.5 times more effective at preventing the onset of diabetes than the leading pharmaceuticals. So eat healthy and prevent diabetes. Easy enough, right? But for the 40 million Americans who are food insecure, who don't have the financial means or the access to maintain a healthy diet, it's not that easy. And so it's no wonder if you are living in a food insecure community, you have a 50% greater risk of developing diabetes. If you're a family making less than $30,000 a year, you're twice as likely to develop diabetes. And it's no wonder that Eat Well pivoted our focus to nutrition security as a causal factor in the onset of diabetes and many other cardiometabolic conditions that are facing the health of our populations today. The second story is, okay, so we figured out nutrition security is a pretty important piece here. How do we address that? And that part was fairly easy. We asked patients, we said, what challenges do you face in accessing a healthy meal? What would make it easier? And we heard a lot of different things. We heard that grocery stores are not nearby, and sometimes I have to go to 4 or 5 different stores to get everything I need. So we took all the ingredients needed to prepare a healthy meal, put it in a box, and delivered it directly to patients' doorsteps. We heard challenges like cooking is time-consuming and it's complicated. So we made sure all of our recipes cook in 30 minutes, and we paired them with picture-based instruction booklets to show patients exactly how to make these meals. We heard complicated challenges like healthy food is expensive, and we figured out how to align our impact with the goals of risk-bearing health insurers and ensure that our meal kits fit the policies to have them be offered as a prescription benefit for patients. And we heard simpler challenges, but still really important ones, like nobody helps me clean up afterwards. And we made sure that, okay, all you need to make our recipes is a knife, a cutting board, a ladle, and they all cook in one pot. We also heard identity challenges. Healthy food like tofu and quinoa, I don't eat that. And again, we asked the community, we said, well, what do you eat? What do you like? And then we worked with our Michelin-trained chef to design healthy recipes that match the taste preferences of the communities we serve. Then we went on to validate our product, and we collaborated with an academic research team out of UMass Lowell and 5 community health centers in Boston, and found significant product satisfaction and really great impact. And we're now scaling our programs with Medicaid insurers in Massachusetts and hopefully nationwide thereafter. The third story is one that comes from the pandemic, and I am going to, again, peek, I don't know what my slide here is. The third story comes from the pandemic. I was working at a food pantry. I was giving out produce bags, and one after another, we saw patients take the bags and go through them and say, I don't know what this is. I don't know how to cook this. I don't know how to eat this. And in May of 2020, when food insecurity had probably never been greater in the United States, families were literally leaving food on the table. And this is the experience that redefined what access means for me, and that physical access to healthy food is not enough, and that healthy food is not helpful if it's not usable. And so access is important, but accessibility is more important. How do I cook? How do I prepare and incorporate healthy foods? These are the focuses of what we're calling Eat Well Community Kitchen, where we partner with local chefs from the communities that we serve to create how-to videos, tips and tricks, engagement with how to prepare and make healthy cooking, healthy eating more accessible for families. And this is really what sets Eat Well apart, I think, in the food as medicine space, in that we are really bringing these two pieces together, not just providing the food resources that are needed, but pairing it with education, and not here's a lecture, here's a seminar, but hands-on learning that is going to show patients how to cook, that's going to make cooking more accessible, it's going to make cooking fun and easy and reduce those fears, and that's going to form healthy habits. Those habits are how we can drive sustainable behavior change that can prevent nutrition security or insecurity, change that can prevent diabetes, and change that can support patients not only over the course of the intervention, but over the course of their life. And that long-term impact is what I mean when I say we're Eat Well, and we believe wholesome food changes lives. Thank you.